The World Health Organization has lost its way. It's drifted far from its founding mission, and it's become mired in bureaucracy, in conflicts of interest, and in international power politics. During the COVID pandemic, those failures weren't just abstract, they were deadly. The world watched as transparency collapsed, accountability disappeared, and ordinary citizens paid the price. That hasn't changed, and it isn't improving.
It was a move that was awaited. Nevertheless, it came as a shock. The fight over the so-called poor handling of the pandemic and charges leveled by the US against the World Health Organization saw a rather unpleasant turn, with America, the largest funder of the UN's health body, exiting it for reasons the Trump administration has been very vocal about. The charges: failure to act quickly during major global health crises, delayed or inadequate early warnings on disease outbreaks, political influence by member states, especially China, lack of transparency and limited access to critical data, bureaucratic inefficiency and slow decision-making, weak accountability for leadership and operations, questionable use of US funding and lack of financial reform, inability to implement meaningful structural changes.
I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year, and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability.
The WHO has denied these accusations, saying it operates based on science, international cooperation, and the authority granted by its member nations to deal with epidemics, maybe even pandemics in the near future. Also, other programs like vaccine rollout in various other states, as well as disease surveillance, all of this is going to suffer a big setback. And that really is the area of concern, given that the World Health Organization is already battling for financial crunch of sorts. This problem is only going to snowball further in weeks and months to come.